historical milestone. It reflects a commitment to quality, to accountability, to collaboration, and to regional and global solidarity in health emergency response. MDMC has distinguished itself through years of hands-on disaster response across Indonesia and around the world. Earthquakes in Sulawesi, floods in Java, pandemic response support, and mass casualty events around the world. MDMC responds to crises constantly. And through each deployment, the organization and the team has refined logistical systems, built volunteer capacity, tested field coordination, and strengthened partnership with governments, society, and health sector partners. This accumulated experience has laid the groundwork for what we will see today and tomorrow. But experience alone is not sufficient. Global EMT classification demands that experience be translated into systems, documentation, standardization, and consistency. And I know that you've all been working very hard on all of those for years, and especially in the last few months. This is so that receiving countries who ask for emergency medical team support know what they're getting. Predictable quality is at the center of this process. This weekend's verification is a way to formally bridge that incredible experience that MDMC has with internationally recognized capacity that can serve other countries in the region and around the world. Verification is not an isolated act just over these 2 days. It's a concrete expression of what we call the Global Health Emergency Corps, that all countries must build local and national surge capacity for emergencies, but also cultivate interoperable resources that can plug into regional and global response systems when crises occur anywhere. By seeking EMT classification, MDMC, and by extension Indonesia, is signaling that it wants to not just be a receiver of international assistance, as has been the case in the past, but to be a credible contributor to regional and global response. In the Global Health Emergency Corps ecosystem, every classified EMT strengthens the fabric of global health security, bringing quality care to people in their greatest moments of need. One of the defining strengths of the EMT initiative is that it's peer-based, with a mutual learning objective and a community behind it. In this verification, MDMC will benefit greatly from the insights of PACMAT, from New Zealand and working across the Pacific, from PMAT in the Philippines. PACMAT is a Type 1 mobile EMT, which brings tested experience in field response, but also a focus on mental health and psychosocial support. While PMAT recently earned 3 classifications in 1 week as Type 1 fixed emergency medical teams, and will share its lessons navigating both domestic and international response. And PMAT is actually responding at this moment to 2 earthquakes that they've had just in the last few weeks. You've had OSMAT as a mentor and RKI ESAR as a twinning partner who have added additional dimensions of operational guidance, cross-context reflections, and best practices. Mentorship and partnership are not to impose ways of working in other countries. It's to enable and share, to help MDMC identify gaps, propose improvements, and strengthen resilience through peer review. We also want to acknowledge the generous support, in this case, from Australia's Department of Foreign Affairs and Trade, who have provided some funding to make this verification possible. And that in itself is a representation of regional partnership and shared commitment to health security. I want to emphasize this exercise today and tomorrow is not a rubber stamp. It's a process. It's rigorous, it's evidence-based, it involves self-assessment, documentation, simulation exercises, peer observation, and candid discussions. We'll be honest, we'll be truthful, we'll be kind, don't worry. The goal is to celebrate MDMC's strengths, but also to identify gaps, to work collaboratively to improve them. That's the essence of quality assurance. For MDMC and for Indonesia, the value in this process lies not just in the badges that you will hopefully receive this weekend, inshallah, but in what you have gained through the journey. Stronger protocols, clear roles, supply chain consistency, performance monitoring, training improvements, and institutional memory building. Classification is useful, but what's more useful is the durable capacity that underlies all of this. So if MDMC successfully achieves classification this weekend, Indonesia will enter the ranks of globally classified EMTs, which will be a demonstration of maturity, of trustworthiness, and of readiness at the global scale. It will strengthen Indonesia's ability to respond more effectively during major events here, but also offer support to neighbors in their moment of need. For WIPRO, the regional office of WHO, Indonesia's addition enhances regional surge depth, our geographic coverage, and the diversity of contexts from which lessons can be shared for improved responses for all of us. And I'd like to note, tomorrow starts WHO's Western Pacific Regional Committee meeting, where all the ministers of health from across the 38 countries and areas will come together in Fiji to meet and discuss the health priorities of the region and of the world. And we really hope and look forward to them being able to recognize tomorrow, as they open that event, that MDMC and Indonesia are now part of the global EMC community.
Okay.
So on behalf of the regional office, I want to congratulate in advance MDMC, the government, and all the partners involved for reaching this moment. Verification is not a final judgment. It should be a catalyst for continued growth and improvement. We're committed to walking this path with you, to working together with you. We will evaluate honestly. We will hopefully mentor generously and kindly, and learn together, because we all have experiences to share and contribute. We look forward to seeing how this weekend's deliberations, exchanges, and reviews can strengthen MDMC and our collective responses and learn from one another. Thank you. Best wishes. Good luck.
Thank you, Mr.